To serve humanity as the leading resource for education, prevention, and quality care is the vision behind CAN Community Health. And I'm so glad to welcome back Jasmine Akins and Prashard Williams to the show. It is great to see the both of you.
You too, now.
Great
How are we?
seeing you as well.
Doing well today?
Doing well.
Good.
So it's an important month, and I feel like this just goes into the mission of CAN Community Health. It is Pride Month, Juneteenth right around the corner, as we were talking about. CAN Community Health is an organization here in the community that maybe people have not heard about yet, but really trying to help change stigmas, all of the things that are important topics right now. Prashard, you're shaking your head already.
Yes, definitely a topic of mine. Just the fear that is associated with stigma as it relates to HIV actually creates a barrier for folks to really know their status.
And you and I have talked in previous conversations. When you hear HIV, obviously the treatments, as we know, have increased tenfold, and we're seeing those have so much more resources and help. However, there's still those who perhaps, aren't aware, aren't in the community. They hear HIV and the stigma goes there.
Yes.
I want to go ahead and get your thoughts. What can we do? Why is it important to talk about this stigma?
Yeah, absolutely. So, when we think about stigma, you think about the fear of really the unknown, right? That's really where it comes from.
Yeah.
I don't understand something, I don't know something, so therefore I'm going to fear it. And often that fear sometimes comes out in a very negative way, so you have the stigma. But as a community, really what we can do, to get past stigma is really just educating ourselves. So with Prashard's team, he's the director of education and prevention here in Tampa Bay. Not only does he provide the testing, but his team is incredibly useful and really experts at providing that education for the community and saying, this is what it actually is. These are the routes of transmission, but even so, these is prevention methods. But should there be a reactive test, and by reactive I mean positive, that might be the more common term, these are the tools that we have. It's incredibly manageable so long as that you're on your medication. So it's really just providing that education piece.
Well, and again, I think that changing that stigma, and even those people who do find themselves, like you said, in a positive test, or the way that you describe it, the resources are available. And that is where CAN Community Health comes in. So if you do find out, yes, I have HIV, or somebody who does have it, and they come into your community, you don't just say yes, and then see you later, here's your medicine, go. Why is it so much more than that?
Well, it's so much more than that because it's a holistic approach, right? Beginning a diagnosis and being treated for it is just one thing. We have so many other factors that can play a part in that. Mental health, a person having that level of support or feeling like they have support within their community, because if it's not being really managed within that individual person, it can become a community problem, and that's where we're talking about community viral loads at that point.
I'm so glad, too, you addressed that issue, because I feel like sometimes people who are watching, maybe they're like, well, this doesn't impact me. And I feel like we need to kind of change that thinking. What would you say to someone who's perhaps watching and they're like, oh, this doesn't impact me?
Yeah, the first thing I always tell folks is we have to get rid of that, like what I call Superman syndrome in our society, right? That doesn't apply to me, that's not me.
Yeah.
If you can have a very honest conversation with yourself, and you should, right? We have the conversations with ourselves about every other aspect of our health. So sexual health needs to be one of them. Have you participated in behaviors, that are linked to increasing HIV risk? You can say yes to any of those things, or when you are meeting with Prashard's team and they ask you questions and you answer yes, being very, very honest with yourself and saying, okay, maybe I need this test. Maybe I need PrEP, right, for HIV prevention. Maybe I need regular testing more than that recommended once a year. So I just say it's really the education, but just being really honest with yourself.
And it's just a vital part of the community, to get rid of this, they, them kind of mentality. I think that this is an important conversation. I know I'm thankful that CAN Community Health is here, a part of our show. We're going to get ready and, of course, share the website on the bottom of the screen. Prashard, any last thoughts, too, as we just kind of wrap up the conversation on changing the stigma of HIV?
Yes, of course. To your point, this is a all-together issue here. We can end HIV together in our communities with just learning a little bit more and fighting stigma.
That's why I wanted to get your last thoughts from you. You said it so well. Again, there's the information on your screen so you can learn more as well.